Hello friends, my name is Dr. Muskaan Chabhra and I'm working as consultant IVF at Birla Fertility and IVF, Lajpat Nagar in New Delhi. Let me welcome you today in this session about IUI. So when you come to the clinic on the day of the IUI, what should you expect? Usually on day 2 of your cycle, we do a baseline ultrasound and see कि आपकी ovaries quiet हैं या नहीं. After this, we give you some drugs. These drugs are oral ovulogens और इनका काम ये होता है कि ये आपकी ovaries में 1 और 2 और 3 follicles की growth को help करते हैं. Usually in a natural cycle, only 1 follicle will grow and it will lead to a monofollicular growth. But in IUI, we usually want that 1, 2 or 3 follicles should form, which will increase our chances of pregnancy. So these drugs, or in some cases, some injections may be given to increase the number of follicles which are growing in that particular cycle. Usually in your cycle up till day 13-14, we will follow the growth of this follicle to see कि whether it is growing well or not. Follicle के साथ साथ, follicle is basically the home of the egg and an egg is growing inside it. If a healthy egg is growing inside this follicle, देन फॉलिकल के साथ साथ हमें एंडोमेट्रियम या फिर जो बेबी का बेड है आपके यूट्रस में उसकी ग्रोथ भी दिखाई देती है. अराउंड डे 14-15 ऑफ योर साइकिल, वंस योर एग इज 18 to 20 millimeter इन साइज, वी विल गिव यू समथिंग नोन एज अ ट्रिगर शॉट. ये ट्रिगर शॉट इज यूजुअली HCG इंजेक्शन and the purpose of giving this injection is to mature the egg which is growing inside the follicle. So this injection will trigger the final maturation of the egg inside the ovary. जिस दिन आपको trigger injection दिया जाता है, उसके 36 hours बाद usually आपको clinic बुलाया जाता है. So when you come for an IUI, you will come in the morning. You can have your usual breakfast and come. Unless of course the IUI is scheduled under anesthesia or something like that. You can have food and drink and you can come. The first thing that we will see is to see what is the status of the follicle on an ultrasound, whether it has ruptured or not ruptured. And once we have assured that, we will ask your husband to give a sample for preparation. जो semen sample husband देंगे, that will be prepared in the laboratory by either a simple wash or a density gradient method and concentrated into a powerful sample which will be inserted inside the uterus. Usually you will be asked to lie down on the gynecological couch and a small speculum will be inserted inside the vagina to visualize your cervix. Cervix is basically the mouth of the uterus. अब इस cervix को visualize करके और इसको clean करके we pass a small catheter which is known as a IUI catheter, which is a small plastic tube inside your uterus from this area, right? And then we push the sample inside the uterus very gently. So the whole purpose is that we put the sample close to where we expect the eggs to be, so that it can help with the conception. You usually lie down and rest after the procedure for 20 minutes. Procedure is not painful. Mild discomfort, yes, but not really painful. Most of the patients tolerate the procedure fairly easily. Once the procedure is done and you have rested for some time, you will be asked to get up, you will be asked to empty your bladder, and you can go about your day in the usual fashion. There are not much restrictions that we ask you to do, and after 15 days we ask you to do a routine urine pregnancy test to check whether the pregnancy has happened or not. So this is the basic procedure of an IUI. If you have any doubts or any queries, you can comment in the comment box below, or you can reach out to us at Birla Fertility and IVF. Thank you so much.
Book a free consultation today.